When you think about Medicare, you think of a federal insurance program. It's close to celebrating its 40th anniversary, and the program provides coverage for those over the age of 65 and for those under 65 who have certain chronic medical conditions. It consists of 4 parts. There's coverage for hospital stays, for medical practice. There's Part C, which is for the Medicare Advantage plan, and Part D, which provides coverage for prescription medications. Open enrollment began on October 15th and extends through December the 7th. It's an opportunity for our citizens to look at their health care needs and look at their current coverage and perhaps what they're paying for that coverage, and then make a determination if they need to make a change. For example, if we have a chronic disease and it's advancing as we age, we may have a change in our medication, or we may have a change in the regimen of care that requires different services, different therapeutic services. Always good to take the time once a year when we have the opportunity to look at what our needs are and then whether we have the appropriate coverage under Medicare. Medicare in itself is not a simple coverage system, and so seeking help to determine what needs are and to determine what may be best alternatives or options for the person is always well advised. In the state of Pennsylvania, we have a free insurance counseling program called APPRISE. APPRISE is a federally funded state health insurance program that's offered through the department's leadership and then through each of the 52 area agencies on aging serving all 67 counties of the Commonwealth. We're grateful to the 600 plus volunteers across the Commonwealth who help us with the APPRISE program, volunteers that undergo intensive training so that they're aware of the complexities of Medicare and are able to listen to an individual, listen to their needs, and then make recommendations as to what that person should consider when they're selecting their plan. They can contact area agencies on aging, which are the most local connection for someone, to schedule an appointment to see an APPRISE counselor, APPRISE volunteer. When they come in, they should have information on their current coverage with Medicare. They should have information on their health, including perhaps a list of prescription medications that they're taking. They should have a list on any particular services they're receiving on an ongoing basis. The counselors are prepared to look at the information somebody brings in, compare it to what we know of the resources and plans available, and hopefully make some recommendations to the individual who's with us. And so the stories we most hear are decisions made that save money for the individual, or decisions made that help people have access to prescription medications or therapeutic regimens that perhaps previous forms of coverage did not provide. That enables our citizens who pursue those pieces of advice to remain in their homes and communities longer, and that's the ultimate benefit of this counseling. Empowerment is based often, when we look at aging, on information and then the connections that people can make. No one ages well alone. We encourage you, particularly if you're a beneficiary of Medicare, to take this time to review your coverage, to review your own health, and to review your needs, and seek the free counseling that's available to you through the APPRISE program.